Hello, everyone. Today we're going to talk about Chapter 20, the childhood diseases and disorders. And the way the book has these broken down is, hold tight here, I'm flipping the screen, is they have it broken down into four main categories: viral, bacterial, fungal, parasitic. And the best part about some of these childhood diseases is many of these can be prevented by immunization. So infectious diseases in kids always have an incubation period, just like in adults. You can see fever, the malaise. Malaise in kids is when they just stop playing and they just kind of lay around. They can cough. Anorexia, they stop eating, or if they are nauseous and vomiting. And many of the infectious diseases also come with specific types of rashes. So the treatment varies with the disease. Most often we are trying to get relief of the symptoms with lots of hydration, lots of rest, good nutrition. We try to teach them good hand washing. Parents have to use good hand washing. The siblings have to use good hand washing. And one of the most important things is when they get a fever, you don't want to use aspirin. You want to use either Tylenol or ibuprofen. And we'll talk a little bit about that later, why we don't want to use aspirin. So let's start with the viral diseases. Usually, all we can do for viruses is treat the symptoms. Many times they can invade the host and lay dormant. They can be reactivated by certain triggers such as stress. And yes, children have stress too. The first one I want to talk about is measles. Measles, the technical term for measles is rubeola, okay? And it is one of the most serious childhood diseases. It is obviously vaccinated with the measles, mumps, and rubella trifold vaccine. It is spread by airborne droplets. It is considered a respiratory disease. You get fever, runny nose, a specific rash, and Koplik spots. And this is the rash that is seen. It usually spreads all over the body. And these are Koplik spots. These are little tiny pinpoint spots that are in the back of the throat. This does not look like strep throat. Once you start looking in children's throats, you get used to looking at different things. But these tiny pinpoint red dots are what they look for with Koplik spots. Okay. The second type of viral disease is rubella. Okay, and it's another type of measles. It's a little bit more serious. It is known as the German measles or the 3-day measles. When I was a young person in college and I couldn't figure out the difference between rubeola and rubella, I had a professor who taught us that Ella is the German exchange student who caught rubella. And that has stuck with me throughout my entire career so that I could know that rubella was from Ella and Ella was from Germany. And that helped me keep the German measles straight from the regular measles, okay? It's very, very, very dangerous to pregnant women because it can lead to birth defects in the fetus, okay? It is less contagious than rubiola. The symptoms are very large lymph node enlargement, nasal discharge, joint pain, fever, chills. So children and women of childbearing age should be immunized. Again, this is part of a trivalent vaccine: measles, mumps, and rubella. Okay, when women are pregnant, one of the first things they do is they will draw a rubella titer. And that titer can tell us, that antibody titer can tell us if they have been vaccinated previously or if they had the disease previously, because it's very important to know if they have not been exposed to rubella, either by sickness or vaccine, and they do not have antibodies. They have to be very careful while they are pregnant. So this is the rubella rash. As you can see, it's a little different than the regular measles or rubeola rash. So mumps is an inflammation of the parotid glands, and these are the salivary glands that are located under your ears, okay? So again, chills, fever, ear pain, swelling of the parotid glands. Um, the complication of mumps can be orchitis in children, in male children, and it can also, if it's left untreated or if it gets bad, it can cause nerve conduction deafness. Okay, so this is a picture of the glands under the ear, the parotid glands, very, very swollen in this young person. Again, it's part of the measles, mumps, rubella vaccine. So now we're going to switch to varicella. Varicella is commonly known as chickenpox. Okay, it is a type of herpes. It is called herpes zoster, and it is highly contagious. The classic symptom are a rash that develop into vesicles, and these vesicles can get extremely itchy. Um, Kids will scratch at them, they will get infected, they can become scars, and the rash is, it can get anywhere on the kids. It is, I had chickenpox when I was 5 because there was no vaccine. My daughters have both been vaccinated against chickenpox. Um, you do not see a whole lot of cases of chickenpox anymore, again, because of the vaccination. But you have to treat the symptoms, and sometimes the kids are not real good about not scratching, and so that's why they tend to get infections. Poliomyelitis, the cause is the poliovirus. Again, immunization has reduced the threat of this disease. We are worried. We thought it was eradicated, but when people stopped vaccinating their children, there has been a slight rebound in it. This is a varicella picture. As you can see, the rash can tend to become pustules. And it is when those pustules get infected or they get scratched open, and it can get very nasty, especially with little ones because they get so itchy. The influenza is an acute respiratory disease. I don't have to tell you this. Usually it occurs late fall through early spring. With kids, just like with adults, we'll see a sudden high fever, very dry, hacking cough, chills, headache, joint or muscle aches. With kids, again, we will see them stop playing. They're just not themselves. Parents will say they're not themselves. Okay, sometimes little kids can't tell you they have a headache, so they'll cry. They won't want to be held because it hurts to be held. The joints and the muscle aches really hurt. So again, prevention is through the yearly vaccination, and the vaccination, every year they try to hit it as close as possible, but they base it on the previous year's influenza. So usually the influenza vaccine efficacy is somewhere between 60 and 85%, but it does help. And even if last year's flu is not identical to this year's flu, it always provides some level of protection. The common cold. Okay, it is the most frequently occurring disease in kids, obviously. The cause is rhinovirus, and right now there are over 200 types of rhinoviruses. So you only get each cold once, okay? But I will tell you, at the age of 50, I still get a cold every once in a while. So obviously I haven't had 200 colds. It is not uncommon for children, young children, to have 10 to 12 colds a year. Parents will get very frustrated because they will say, my kid is sick all the time. Usually that tends to slow down by the time they become school age. And one thing that we have found is children who do have a lot of colds in the infant and toddler years tend to have better immunity once they do get to becoming school age. Again, best prevention is good hand washing. We are trying to teach the younger children to wash their hands as much as they can. We try not to use hand sanitizer too much with young kids, just because sometimes when it smells really good, they want to eat it. Respiratory syncytial virus is also known as RSV, and this is an infection of the airways. It's the most common cause of bronchiolitis and pneumonia in infants. It is caused by, like I said, the RSV virus, okay? The symptoms, it just appears like a cold. And for many people, you would never know your baby had RSV because they got a cold and it resolved and you obviously didn't have it tested. It becomes a problem, okay, when it develops into pneumonia. Okay, and there's no treatment needed for most of it, but if they're under 6 months of age, um, their lungs aren't quite fully ready, their immune system isn't quite fully ready, so they a lot of times will be hospitalized for the treatment of symptoms. Maybe they're not nursing or drinking, so they might be dehydrated. They may need some oxygen to get them through. Okay, Fifth's disease is another type of viral disease. It's also known as slap disease because it looks like the child has had their face slapped. Okay, it's very contagious viral disease, very common in children. It's caused by parvovirus. Um, Again, it's just another rash, usually on their face. They'll have fever, runny nose, swollen joints. So basically, again, you just treat the symptoms for fever and pain. Um, you know, um, we will see this in doctors' offices because parents will see the rash and panic and want it identified. So if it looks like the child's face has been slapped, don't automatically go to child abuse. Okay, do some other follow-up and see what's going on. Mononucleosis. This primarily affects children and young adults. So this is very common in junior high schools, and colleges because kids are kissing each other, hugging each other, very close to each other. It is caused by the Epstein-Barr virus. Okay, the symptoms are fatigue, sore throat, fever, swollen lymph glands. Many times people don't even know they've had mono. Um, my one daughter spent a winter where she was sick the whole time, and finally, I think in April, they decided to test her for mono, and when they tested her, she had already had the antibodies, so that meant she had been exposed at least 4 or 5 months before that. Um, and so probably was just manifesting this all winter long, but they never bothered to test for it. So Epstein-Barr virus is a test that they do blood work for. They can tell if the patient is in an active initial Epstein-Barr virus problem, if they have had the disease and have antibodies for it. But this is also something that can reactivate in a patient. It isn't very common in healthy young adults. We can see reactivation in immunocompromised people. AIDS, we discussed this in detail in Chapter 5. It has now affected thousands of children throughout the world. Most of the time, it was a result of maternal fetal transfer, meaning it either transferred while the baby was in the mother in utero or during the birthing process or during the nursing process. Children can suffer from symptoms, and many are often orphaned, not so much in this country, but in other countries. There is no treatment for it. The treatment focuses on prevention. Now we're going to switch to the bacterial diseases. These are usually caused in kids by one of three different types of bacteria: staph, strep, Haemophilus, or Clostridium. Okay. Most of the bacterial diseases present just like the viruses, with the cough, the fever, difficulty breathing, the sore throat. And the treatment, again, is based on the causative agent, which one of those bacteria are giving it to us. So pertussis is the first one. Pertussis is also known as whooping cough. The symptoms are cataralysis. They will have the paroxysmal spasms. This is where the coughing is just so sudden and intense and brief, okay? And it can just be absolutely violent, and it'll sound like they're whooping because when they take their air in, it's having trouble getting in. Diphtheria is a severe inflammation of the respiratory system. It was a leading cause of death in children, but it's very rarely seen now. You will get childhood vaccinations, or you can get them as an adult. The DPT, you get diphtheria, pertussis, and tetanus all in one vaccine. Usually you only need to be vaccinated against pertussis once. What they were finding is the pertussis, that vaccine that I got when I was younger, was not strong enough. So the last time I got a tetanus shot, I was also given pertussis. My older parents, back in the 2000s, early 2000s, were also given pertussis because they were helping take care of my small children. And pertussis can be especially rough on older people. So these are typically childhood diseases in children who are unvaccinated, or in perhaps who've had the vaccination, but maybe their immune system has not developed strong antibodies yet. Tuberculosis, there is no vaccine for tuberculosis. There is no way we can prevent it, but we can treat it. Okay, it most commonly affects the respiratory system, but it can be systemic. It can get into the bones, the brain, the lymph node. It is very easily tested for by a PPD Man2 test on the arm. It can be picked up on chest x-rays. We are seeing an increasing number of cases in children, and we are not sure why. But once someone gets tuberculosis, they can be given antibiotics to treat the tuberculosis. Tularemia is also known as rabbit fever. It's transmitted by the bite of an infected insect or direct contact with an infected animal. One way of preventing it is to avoid tick bites, not let your children pick up spiders. Wild bunnies should be avoided. They tend to get scared and bite kids. So we don't see a lot of tularemia, but especially in the summer when kids are outside in the woods, they can experience this. Impetigo. Impetigo is a contagious disease. It's a superficial skin disease where the little pustules fill with pus, okay? And it's usually caused by staph, a group A strep. Both of these things grow on our skin normally. It's when they start to overgrow, okay, because of the impetigo. We treat the infection. Usually the skin will get cultured. They'll unroof one of the pussy lesions, and they'll culture it, and they'll find out if it's staph or the group A strep. Again, good hand washing, good hygiene. Very important for kids to get baths every day or every other day. Acute tonsillitis. This is an infection of the palatine tonsils, and they are located on the back wall of the nasopharynx. So they're in the back of the throat, okay? The cause is usually a group A beta hemolytic streptococci. So the symptoms are a sore throat, very enlarged tonsils. They can be treated with antibiotics. If someone keeps getting this, they may do a tonsillectomy. And tonsillectomies are much easier to do on children than they are on adults. Ear infections, middle ear infections, we just talked about that. Acute bacterial infection of the middle ear. If they're left untreated, chronic infection develops. The pain, the fever, the ear drainage. Again, treatment, if it's bad, they will use antibiotics. If they keep occurring, they will use antibiotics to try and put a stop to it. If the eardrum is ready to burst, they will do a myringotomy with a tympanoplasty, where they put a tiny little slice in it and stitch it up. Now we're going to switch to fungal diseases, okay? And these usually affect the skin or the mucous membranes in children. So we are talking about the insides of their mouths. Usually it's not real severe, okay, but they're more irritating, and they may need medical attention to prevent the spread to other siblings, the spread to other kids in the daycare or the school, or to other siblings. Okay, the first one I want to talk about is candidiasis. This is also known as a yeast infection, okay? And yes, this is the same yeast infection that adults get. but it is very common in infants in their mouth, and it's called thrush. We don't know how they get it um, on their fingers, but they do. And when their fingers go in their mouth, they get infected. In the diaper area, it's called diaper rash. Again, the cause is an oral fungal infection. We can prevent it by keeping the little one's hands washed. I think many times parents forget to wash their baby's hands, and prevention can be prevented by breastfeeding, because there's something in breast milk that is almost a natural antifungal. Diaper rash is treated by keeping the area clean and dry. Anything that's warm, wet, and dark, aka a wet diaper, is the perfect area for a fungal infection to develop. Tinea is also known as ringworm, okay, and it's a group of diseases. Tinea capitis is on the scalp, tinea pedis is on the face, and tinea cruris is on the groin and scrotum. And again, these can occur in anyone from infants through adults, but we'll see it on children on their scalp if maybe they have a hat on all the time and we're not allowing their head to air out. Same with their feet. The groin and scrotum, especially in infant boys, is prone to this because it likes to grow in warm, dark environments. And when their diapers are wet and warm and dark, there you go. Parasites that we see in kids are caused by organisms that feed on another organism, okay? Mostly they are found in places of poor nutrition, contaminated water, low socioeconomic conditions, but they're not exclusive to these places, okay? I want you to know that. And parents of children who are not in lower socioeconomic conditions are absolutely mortified when their kid gets a parasite, and it can happen. There are only a few common ones in the United States. The first one is giarditis. It's caused by a protozoa called Giardia lamblia. Young children are most often infected. This protozoa lodges in the lining of the small intestine. They get diarrhea, nausea, cramping, flatulence. This is usually caused by water contamination. Pediculosis, this is an infestation with lice, okay? And I can tell you that lice in a school classroom does not discriminate via socioeconomic classes, okay? It is transmitted human to human by direct contact. Lice eggs are called nits. It's an epidemic among school children. It can be treated with permethrin, okay, which is a special type of soap that has the permethrin in it. The biggest problem with lice infections is the kits that you buy in the store are about $25. So those students that come from lower socioeconomic classes can often miss multiple days of school when they are sent home with lice because the parents don't have the money to go buy the treatment. Many schools will provide lice kits to patients of lower socioeconomic children so that the students don't miss school because we don't want them getting behind. Pinworm, these are parasitic nematodes that infect intestines and rectum. It's transmitted by the ingestion or the inhalation of eggs, okay? The symptoms, you'll see kids scratching at their rear end. The worms appear as tiny white threads. Roundworms, these are found in soil. These are also parasites which lodge in the intestine. They are spread by hand-to-mouth activity. Kids love to eat dirt. Kids love to play in the dirt. So that's why it's so important for them to wash their hands really well. And what happens is the roundworms absorb the nutrients from the host and deprive the children of the nutrients in their food. Respiratory diseases, these are the most common childhood diseases seen by physicians because children are very vulnerable because they continuously have person-to-person contact. They play with each other, they hold their parents' hands, they're hugged by their parents, they're hugged by their grandparents. Infants are most susceptible Sudden unexpected infant death is a respiratory disease. We don't know the cause, okay, but infants suffocate and it's abrupt. It's usually unexplained death in an infant under the age of 1. Okay, it's very traumatic on the parents because they don't even know what happened. Croup is also known as laryngotracheobronchitis. This is an upper respiratory infection, okay? It affects children usually between 3 months and 3 years, but we can see it in older children. And the symptom is very, very, I want to say predictable. You can expect an inspiratory stridor. It's a very high-pitched wheeze when they are taking a breath in. And you can usually hear it without a stethoscope, and when you listen to them with a stethoscope, it's very pronounced. Adenoid hyperplasia, these are enlargement of the pharyngeal tonsils. It may require the pharyngeal tonsils to be removed and with an adenoidectomy. Asthma is a very serious chronic respiratory disease in children. The symptoms are acute coughing, wheezing, shortness of breath. The cause is unknown. The treatment is to have them with a rescue inhaler and to try to eliminate triggers or the stimulus that causes the attack. Pneumonia is an incredible infection of the lung parenchyma in children. The symptoms are cough, fever, wheezing, malaise. If it's a bacterial pneumonia, we can give them antibiotics. If it's viral, it will usually run its course in 5 to 7 days. That does not mean we might not have to hospitalize the child if they're not getting enough oxygen. Usually if they're hospitalized, it's because we have to treat the symptoms. Okay, they aren't getting enough hydration, they aren't getting enough oxygen. So as far as digestive diseases go, children can experience serious developmental problems when they don't get enough food, digest enough food, absorb enough food, or eliminate enough food, okay? Fluid and electrolyte imbalances frequently are more severe in children just because of their smaller size. As adults, we can afford to lose a lot more liquid and not get dehydrated. Children can't afford to lose a lot of liquid. It can be when they're vomiting, when they have diarrhea. Colic is a common symptom of digestive problems. The child has a GI pain, they cry, they're irritable, and the pediatricians really work hard to identify colicky babies so that they can get a different type of formula, which can help promote better digestion and absorption. Fluid imbalances, like I said, they can be very serious, almost life-threatening in children. Food allergies most often start to occur under the age of 1. The most common allergies are to cow's milk and eggs. Many of the food allergies disappear after the age of 5. The rule of thumb is if a food allergy develops after the age of 3, it usually continues into adult life. So that area between the ages of 3 and 5, you're seeing if many of the food allergies that they had when they were an infant and toddler are going away, and are they developing new ones. Eating disorders are a major problem in children. We especially focus on adolescent females, but it also happens to adolescent males, okay? The 2 most common types are anorexia nervosa, which is where people do not eat at all. The other type is bulimia, where they eat, but then they force themselves to vomit to get rid of the extra food. Cardiovascular diseases in children are usually related to a genetic or developmental disorder, which we will have had discussed in chapter 19, so I don't get really too much into them in this chapter. Musculoskeletal diseases, okay, they are very common in children due to high activity levels. They play, they break things. It can range from soft tissue injuries of bones, bruises, and to fractures of joints and bone deformities. Sometimes there are degenerative muscle disorders that we have to worry about with kids. Two of the big diseases in children, Legg-Calvé-Perthes syndrome. This is when there's avascular necrosis of the upper end of the femur. For some reason, it causes changes in bone growth. So usually if when it's picked up on um, childhood screenings, when they go for their annual checkup, mom or dad may notice that the child is kind of limping or has a very odd stride, so they will go get it looked at. It can be treated, so it does not have to lead to permanent deformity. Ewing sarcoma, these are malignant neoplasms which occur before the age of 20. They're usually in the long bones, okay? It's more common in young men. It is very highly metastatic, highly malignant. So Ewing sarcoma diagnosis usually is a very serious disease, and they can have very poor outcomes. Leukemia is a malignancy of blood-forming cells in the bone marrow. This is the most common disorder of blood and blood-forming organs in children. Okay, it usually starts around, they're very pale, they bleed and bruise easily, they're fatigued, they have joint, bone, abdominal pain, so they'll get a blood test, and the blood test will tell us if they have leukemia. Treatment, it is among the most curable diseases of childhood cancers, but it is a very aggressive treatment, and it is very hard on their young bodies. It involves chemotherapy, and it usually is a course of about 18 months. So it's very hard because many times they can't go to school because they're immunosuppressed from the chemotherapy. It's very, expensive. People worry about what am I going to do if I can't pay for the chemo for my child. So it has a lot of social aspects that go along with it. Reye's syndrome, this is an acute encephalopathy. So this is a problem with encephalitis, okay, in children under the age of 15 who've had some type of viral infection. We don't know what happens. They could have any number of a viral infection, but if they were used aspirin to treat the fever, sometimes it can cause this Reye's syndrome. Now, we don't have a lot of aspirin products for children anymore because of this. Most of the time it's, generic forms of Tylenol, generic forms of ibuprofen. But it actually came out from my generation because there was no ibuprofen for kids. And when you got sick, you got a baby aspirin. Okay. And so after, a number of children developed this encephalopathy, they figured out that it came from young children being given aspirin. The symptoms are nausea, vomiting. The main one is liver enlargement. The lethargy in children. It can result in seizures, coma, and in many cases death if it's not treated quickly enough. So rule of thumb, when we are counseling parents, do not give them any aspirin products to lower a fever. Eye and ear diseases, we talked about this before, can have a profound effect on a child's ability to learn and develop. So that's why they are screened very early and they are treated very early. If a child has strabismus, remember we talked about that lazy or cross eye, their good eye is covered and their bad eye is trained. Deafness, the causes, remember we talked about genetic causes, trauma, infection, exposure to some drugs that are toxic to the ear. Again, we want to make sure that if they are deaf, we teach them sign language and teach them other ways to learn. If they can't see, we want to teach them other ways to learn. There's so much progress going on right now that most of the time it doesn't impede them at all. The main thing is getting the diagnosis very early. Trauma. Child abuse is a serious problem in the United States. We all know that. It's often fatal because their bodies cannot take the punishment. It can be emotional, it can be physical, it can be sexual harm or just neglect. Okay, emotional abuse obviously is very hard to diagnose, okay? We see it occurring in epidemic proportions. There are screening questions. Now, daycares are required to mandate to produce, are mandated to report anything they deem suspicious. Schools are required, doctors are required. There are a lot of screening tools that are in place, but we still, lose some because they've fallen through the cracks. Suicide is the second leading cause of death among young people. Prevention, early intervention is so important, and it is so hard with adolescents because they don't want to talk to their parents. So they will do screening tools when students or adolescents come in and pre-adolescents come in for their annual appointments. But again, if the patient is not open and honest with you, a lot of times we can't prevent it. Drug abuse, it's crazy. It's especially prevalent among adolescents. The illegal drugs, alcohol, tobacco use, it's an epidemic in America. Poisoning is among the top 5 causes of accidental death under the age of 10. Okay, most poisonings are due to common substances found at home, cleaning products, medicines, plants. We see huffing, which is causing a lot of poisoning. So if it's a little bit older child, maybe a preteen, and they've been dared to huff something, they want to get high, it can be seen and it will incorporate as a poisoning when they present to the hospital. So that's everything for this chapter. Thank you very much and have a great week.